Hi, everyone. Good morning, good afternoon, good evening. Catherine Mattice here with Civility Partners. I am the founder and CEO, and we focus on building positive workplace environments. And so I am super excited to talk to Dr. Saundra Dalton-Smith today, who focuses on rest, which we all need. She's a board certified physician with over 20 years of clinical practice. She's written a best-selling book called Sacred Rest: Recover Your Life, Renew Your Energy, Restore Your Sanity. That's been featured on CNN and Inc. and Fast Company. She's also a TEDx speaker. And she has a website, restquiz.com, where she's had over 250,000 people figure out what their rest deficit is and go from there and repair it. So thank you so much for being here with me today.
Oh, thank you, Catherine.
My first question is, how in the world did you get interested in sleep and rest? Tell me that.
Simple answer is I burned out. So I'm a board certified internal medicine physician. I've been in practice. Now I've been in clinical practice for 20 years, but about 10 years in, I got to this place where I just had kids. I had two toddlers at home, married, and just too many things. I had too many balls in the air at one time. And really no understanding of work-life integration, no understanding of personal boundaries, and just got to a place where I burned out.
Okay. And so then you're like, I got to turn my practice into rest and understand all of that. Yeah, that makes sense. I know.
Yeah, well, the thing was, I really felt like the healthcare community didn't prepare me to actually treat that. The only literature that was really out there at that time, if you were someone who was exhausted, was get more sleep. So there was a
Yeah.
lot of focus on how to sleep better and sleep hygiene. And that was really all anyone was talking about. Everyone was basically putting sleep and rest in the very same bucket. And so for myself, during that burnout phase, I took a long period to try to get better sleep. And I felt like I was getting extremely high quality sleep and I was still exhausted. So then what? You go to bed for 8 hours and you wake up and you're like, I'm still exhausted. That's when I knew there was something else that we weren't hitting on.
Okay, so you're really at the forefront of understanding rest and sleep. And I know in your TEDx talk, you said that sleep is one piece of it, but not all of it. So I know stress management is a big topic, right now, and maybe always has been. But you feel like stress management isn't necessarily the answer. Talk to me about that.
Yes, I think stress management is really it's what's gotten many of us in trouble and why so many people kind of brush it off as this kind of idealistic thinking. Because, when you think about stress in our lives really are the changes and the challenges that we confront. And so the word management kind of makes you believe that you can pick and choose, that you can decrease it and increase it at will. And the reality is many of the changes and challenges that come at us are not things you have control over. So you
Right.
really can't manage it. What you can manage is your response to the stress. And so I
Mhm.
think we put a lot of focus on that term, stress management, with people thinking that they can some way decrease their stress, because we hear people say that, well, you need to decrease the stress in your life and
Yeah.
then things will be better. Well, what if you can't do that? What if it's an elderly parent with a chronic disease that you can't decrease that? What if it's COVID? You can't get away from that.
Yeah.
There's so
What if
many
there's a
changes.
pandemic? You can't,
Yeah,
call me crazy, but it happens.
there's so many changes and challenges you can't pick and opt out of. And
Yeah.
so we really have to focus on what we can control, which is our response. And really, rest is a restorative response to those stressors. And so that's where I have people focus their attention. Because if we're going to build resilience, we have to stop looking at resilience as the resistance to breaking and start
Mhm.
looking at it as, how do I take that stress and challenges that come, combine that with a restorative strategy and process to build myself up so I can get inner growth and strength, which is
Mhm.
really what resilience is.
Can you give me an example of that? So let's say I have a parent with a chronic illness and that's
Mhm.
causing me a lot of stress. Talk me
Yeah,
through this idea of what you're talking about, not managing the
absolutely.
stress.
So the stressor is that you have this elderly parent. So
Mhm.
what's the energy that you put out related to that stress? So the energy you put out may be some emotional energy. Maybe you're carrying a lot of emotional labor where you're not allowing that parent to understand kind of how it's affecting you. I
Mhm.
have a friend right now whose mother is actively dying through ovarian cancer. So she doesn't have her mother conversations about all of the things that are kind of pouring onto her, all of the things related to the will and the estate and all of that. She doesn't burden her with that because she wants to enjoy these last days and hours with her
Yeah.
without the labor of that. So she holds on to all of that emotional labor related to those things.
Mhm.
Now, that is causing her to be emotionally fatigued. She has an emotional rest deficit because of the emotional labor she's carrying with that. So, how does she restore that? She has other people, not her mother, that she's going to share about, the difficulty of that, but
Mhm.
other people who are safe places where she can express herself. She can be really real and authentic about those feelings. And that's where she's experiencing the emotional rest. And so we
Wow.
have to look at, where are we spending energy?
Mhm.
And what are we doing to pour back into that very place where we're pouring out, so that we can stay full and stay rested in that area?
Okay, that makes sense. What about like I think resilience, because you brought it up. When we talk about resilience, you hear a lot about sort of finding a plan or creating a plan for yourself, and taking baby steps to sort of crawl your way out of whatever the challenge is. And then that builds your repertoire of skills, and that because you see a light at the end of the tunnel, you can be resilient. What
Mhm.
what if you have something like a parent who's, just to keep using that example, because there isn't like a plan to develop around that. It's happening. I'm just curious what your
Yeah.
thoughts are on that.
Yeah, I love that. I love the reality of that, because I think sometimes when we think about work-life integration, we put so much focus on the professional aspect of it, but it's usually our personal life that's
Yeah.
draining us more, because work, sometimes we are able to get some healthy boundaries around, and we understand that there's some parts of our personal life that you can't just block off, that
Mm,
that they actually are integrated very well within our 24 hours, and we have to be able to have some strategies based around that. And so, in the case of this particular situation, if we're dealing with like an elderly parent, there are some strategies that you can start putting into place. You're not going to be able to control the stressor, as I mentioned. So you're not going to be able to control, when is the end of lifetime coming. You're not going to be able to control those things. And
right.
so the things we're controlling, we're looking at in the case of restoration and rest. Let's say, for example, if we're thinking about just the sensory aspect of that,
Hmm.
sensory being those external things around the home that can increase your likelihood of being irritated or agitated. The lights, the sounds, the smells. Being aware of that. Many of us aren't even conscious. If you
Yeah.
walk into that parent's home and every time you walk in, the TV's playing, nobody's listening to it. That's a sensory input that's going to cause you to feel more sensory drained or kind of sensory overwhelmed, because
Yeah.
you're consuming that even without consuming it, without being
Right.
aware. Another example would be, if the home that you're, if the where the parent is at, let's say, for example, you're spending most of your time sleeping on the floor because there's no extra guest room, or 15 family members are at the house because of a hospice type situation or something. Then be aware of that. Be aware of what that's going to do to your body. And
Hmm.
so, if you're waking up achy and painful, that's the signs of a physical rest deficit. Your body has been in a toxic position that's now caused it to have pain and discomfort. So if
Hmm.
you recognize that, then a strategy could be, okay, when I get up, I'm going to spend a few minutes just kind of working out the kinks. I'm going to spend a few minutes doing some stretching, some yoga, if
Yeah.
your mind's bogged down, maybe you're going to spend a few moments writing in your journal, so that you're not having busy brain and you're not able to actually focus and concentrate. So there are
Right.
small things that you can do for each of those 7 types of rest, if you're seeing them being depleted, without having to take a big chunk of time or break away, just kind of being very intentional about kind of refilling those places.
Tell me, so I saw that on your TED Talk too, the 7 things. It's mental, emotional, social. Give
Yeah.
us the list of 7.
So the 7 different types of rest I discuss include things like physical, mental, spiritual, emotional, social, sensory, and creative. And all of these are from my research that I've done with patients who also were saying the same thing I was saying. I'm so tired,
Yeah.
but as a physician, if someone, it's no different than as a physician, if someone comes to me and say, hey, doc, I hurt. Okay, what am I supposed to do with that? How do I treat that? How do I even know where to look? Because
Yeah.
you hurt, there's too many options. So when
Yeah.
someone says, I'm tired, there's too many options. We need to evaluate, make sure there's no true medical reasons for that. You don't have sleep apnea, your thyroid's not messed up. If
Yeah.
all of those things are normal, which is a lot of people, their doctors can't find anything wrong with them, but they're just tired. That's when we start looking at those areas that might be depleted because of these rest deficits.
Okay. So patients come to see you as a sleep specialist, essentially, and you help them figure out. Are you still seeing patients, or are you
Yeah,
focused
my
on?
my
Okay.
practice is actually internal medicine. So
Okay.
honestly, best sleep was not nowhere in what I was trying to do. As an internist, I'm in the ER, I'm in the ICU, I'm treating heart attacks, strokes, cancers, blood pressure,
Yeah.
typical internal medicine, typical internist. But what I was finding is a large number of people would come to me, specifically thinking that their thyroid was messed up or they had this
Right.
specific medical problem that was causing them to be tired, and nothing was wrong with them. It
Yeah.
was lifestyle issues that was really causing them to be tired all the time. Lack of boundaries, lack of really living in these very toxic mindsets where they valued the work much more than they valued the rest.
Right.
And
Right.
honestly, that's where the book Sacred Rest came from. I found that I spent so much time teaching this to patients that I would be behind. I mean, everyone's been to a doctor's office where you're like, why is this taking so long? Well, if the doctor's trying to explain 7 types of rest in 15 minutes, believe me,
Yeah.
it
You're
extends
like,
out the
sign my
visit.
book.
So that's why I was like, I have to have some way of teaching this to people that doesn't have me sitting in front of them for, 30 minutes past their 15-minute visit.
Yeah. Yeah. This is so interesting. Now, in your TED Talk, also you talked about work being the 5th largest cause of death. Tell me more about that. I'm a
Yeah,
workplace expert, and I focus on workplace bullying and toxic environments. So you definitely caught my attention.
That's really interesting. That's where most of my work now is focused with. I have lots of corporations that contact me specifically related to employee well-being. Specifically has skyrocketed since the pandemic because so many people do not understand personal energy management.
Mhm.
They know they're tired, but they think that the vacations are going to fix that, and it's like a temporary situation trying to fix a chronic day-to-day problem. And
Mm-mm.
so that lack of energy management, many people, even if they wake up and they feel okay initially, is as if work is like draining the life out of them, and they
Mhm.
don't know how to manage their energy within their workplace. And
Right.
so we see this kind of escalation of the number of people. I think the last statistic I saw was based on a study that came out around May or summer of 2021, was talking about over 67% of workers feel like their burnout has increased since the pandemic. Well,
Right.
it was already high before the pandemic.
Yeah,
So
we were
you're
already struggling.
7%. I mean, that's ridiculous when you think about it. The
Yeah.
number of people who go to work and they feel like their work is just further draining them. And so it's so important now for, I think, many companies to understand that when we're looking at employee engagement, we're looking at retention, we're looking at their ability to be productive, to be creative, to feel like they're a part of something bigger so that customer service
Right.
improves. And
Right.
even within the healthcare industry, so that patient outcomes improve, they have to understand energy management. And it has to be something that they can understand that they can actually improve in the middle of their workday. That it's
Right.
not going to take away from their productivity, but actually improve it.
How do we talk leaders into paying attention to this? Because, I try to practice what I preach. If I can see that my staff or employees are, stressed out, then I send them home. I remember one of my team members, she started with me when she was in college, and she just was visibly very stressed out about her finals. And I'm just thinking, I could pay you to be here and force you to stay, but you're probably, that's what I'm thinking in my head. You're not going to probably produce much because you're like, I would rather you just go home and study and everybody wins. But I
Mhm.
think a lot of employers don't function that way. How do we talk employers into recognizing that you're not actually losing time if you let someone go home? I feel like you're actually gaining loyalty as well as higher productivity, because once those finals are over, she was going to come back and probably give me her all. How do we help employers and CEOs see that?
Well, what I'm finding with the work I'm currently doing with most companies is that many organizations do not have a wellness initiative vision. They
Right.
don't know what that looks like for themselves. And so a big part of that with the consulting and with really taking time with those that are in those management type positions is helping them to first get a wellness initiative or well-being initiative vision for their
Hmm.
organization. What does it look like to be have a company culture that understands the value of its most important resources? It's
Right.
humans, it's people
Right.
that are
Right.
inside the company, and understand that building them up and making them feel as if they're part of this well-being culture actually not only gets more out of them just naturally because they feel engaged, they feel supported, they feel celebrated, they feel like their strengths are uplifted and that
Right.
their weaknesses are recognized without being condemned. And so I
Right.
think that's a big part of it, is just first of all helping them see the vision, because
Hmm.
too often I think the vision is kind of focused around the financial. And so you have to bridge that gap. You have to help them to be able to see, and particularly as a physician, I've worked within those settings where we are working with companies that have very high workers' comp and very high injury rates and very high accidents rates. I've worked within those type settings, so
Yeah.
it's helpful for sometimes for people to see how those two merge together. If you have a culture that does within your company that does not have any appreciation for the need for wellness and well-being, then you are going to eventually transition to a company that has a lot of incidents, accidents, and turnover, which is going
Right.
to cost you more money on all ends.
Right. I find that with a lot of initiatives, it's like it's a buzzword. And so employers just jump in. Employee engagement is another great example. What does employee engagement even mean? And the employer has to maybe decide what that is or work with some employees to figure out. When we say engagement, it means that employees are working hard and they want to be here, but what else does that mean? Gallup defines it as enthusiastic. At Civility
Mhm.
Partners, we define it as being inspired and feeling like you fit in. And those are two very different
Yeah.
versions. And same with well-being or wellness programs. That is it just like, let's get an EAP and some running contests going, and yeah, I think you got to define like what's the goal before you
Yeah,
can do
and I
any of
think that's the thing. It's that vision casting. It's that creating an idea of what it looks like.
that.
Because
Yeah.
I think sometimes the reason that many organizations kind of, as you mentioned, it's kind of a buzzword. It's like, oh yeah, we have a wellness initiative. We offer whatever it is,
Yeah.
and it's just one or two little offerings that are being thrown in there as a
Yeah.
wellness initiative,
Yeah.
which may be wellness benefits. I think we have to get the terminology correct. Maybe wellness
Yes.
benefits, but is it an initiative? And for me, when something is an initiative, it's like we are trying to create something. We
Hmm.
are we are we are putting together a task force, a group of people, some leaders, some consultants, some vendors. We're putting together a group of people with a mission and a goal to see a transformative change within whatever that topic is. So if
Right.
it's a diversity initiative, then it's a change within the diversity complex. If it's a
Right.
wellness or well-being initiative, then it's a change in the culture of how we look at wellness and well-being with the people within that.
Yeah.
And so I agree with you. I think we use some of these buzzwords and it's like, well, what exactly does that mean? And so I think that's why it's so important to have people on retainer or consultants that you're working with that can help you with that vision, because I think you have great people within your company, but that may not be their area of expertise where they
Yeah.
can actually see beyond. I think that's the big thing about innovation within any company, is sometimes you have to bring people that are outside of your field to see what they can add to
For
what
sure.
you're already doing.
For sure, for sure. Yeah. All right. My last question for you. I know you have your seven different areas for rest. I feel
Mhm.
like mental is a big one for me. You know, my brain is so powerful and smart that I can't sleep. Just kidding. But yes, I have that. I think I have a hard time turning my brain off at night.
Mhm.
And so, what are some techniques that me and others could implement for that?
Yeah, so mental rest deficits are probably the number. Well, before COVID, it was definitely the number one.
Uh-huh.
After COVID, it was mental and sensory that were tying often for number one. And so, with mental rest, the way it can present could be just like you mentioned. You can't turn your head off to go to sleep, which one simple tactic that helps a lot of people is just being able to get that information out of your head onto something concrete. The
Hmm.
way the brain works, if you're ruminating over information, you're basically telling it that you want to hold on to that information. When we
Hmm.
ruminate, it's no different than when we were studying for that chemistry test in high school or college. So you
Yeah.
think about it over and over again, trying to retain it. But when you put it down on something concrete, like if you are brainstorming or thinking of a conversation you had earlier that day, rather than just letting the rumination process continue, jot it down on, I mean, it could be a notebook, it could be a journal, it could be just a post-it note. You
Yeah.
really just want to put it on something concrete to give your brain the opportunity to release it, because
Okay.
now it doesn't take on the responsibility of holding on to that bit of information.
Yeah.
Another type of mental rest deficit can include the inability to concentrate.
Right.
If you find that you're trying to remember a couple of items and pick them up at the grocery store, and you walk in and it's like, I got two, but I can't remember that third item. That, especially if you're a younger person, you're not 85, you don't have dementia, you just can't retain information well. A strategy that can help with that is actually practicing, not what I call multitasking brain syndrome, where
Okay.
many of us are consistently jumping from information to information. We
Yeah.
don't spend time in deep work. We don't spend time really focusing on one thing at a time so that we can retain, and to
Yeah.
be aware of that. To be aware that the way that you keep your brain in the process of memorization is that you'll give it space to be able to concentrate on small blocks of information, not
Right.
multiple things at one time.
Yeah, that is the problem. I mean, on our cell phones, it's like I do have a running notepad of all sorts of things. Errands I want to run this weekend. As soon as I think of it, I write it down. My grocery list is in there. But then you hop to Facebook and you see some news article and you got to go and do that. And then, yeah, it's we're in a crazy world, and it's only going to grow the amount of information coming at us, right? It's
Absolutely, and
not
I
going to
think
get
that's
less.
smart. That's a great strategy to,
Yeah.
if you know that I'm not gonna be able to retain this information without writing it somewhere, it's gonna go in and go out because I have too
Yeah.
many things coming at me at one time. That is a great strategy to already be prepared for that. Then you don't waste unnecessary time wandering around the store trying to remember that third item.
Yeah, I'll give a tip too. I actually I have an Alexa in my room, and I used to fall asleep watching TV, which I know I've known for years and years. You're not supposed to do that. And I decided to switch it up, and I ask Alexa to play. I just say play sleeping music, and I fall asleep like that. So that has been super helpful for me to help me turn my brain off, and I don't fall asleep to the TV anymore. And I'll wake up sometimes at like 3 in the morning and it's still playing, and I just drift right back to sleep. So
Love
that's
that.
been
Here's
useful.
another quick tip for those who may be finding yourself waking up often at nighttime. I
Mhm.
realize a lot of people aren't aware of how light affects their circadian rhythm and how it
Mhm.
can actually disrupt them. So if you have an alarm clock in your bedroom, particularly one that has those the kind of bright red or bright
Yeah.
blue lights on them, most of us have the alarm clock actually facing us so that if we wake up and kind of open one eye, we can see what time it is. I actually would recommend you turn it so that it's facing away from you or facing straight so that
Uh-huh.
the light isn't actually kind of reflecting back in your face while your eyes are closed sleeping, because
Ah,
even though your eyes are closed, the skin over your eyes is so thin that the light still permeates it. And
yeah.
so if you're very sensitive to light, as many of us are, we need very dark rooms to sleep well, that little bit of light from that alarm clock focused in on your face while you're sleeping can actually disrupt your sleep cycle at nighttime.
Okay, good to know. So turn the brightness down, or turn it away from you.
Mhm.
I just asked Alexa in the middle of the night what time. Alexa, what
If
time is
you
it?
really needed to know, there you go.
Yeah, she's my roommate. Well, thank you so much, Dr. Dalton-Smith. It was really a pleasure to chat with you. I learned a lot, and I really enjoyed your TEDx talk. So I recommend everyone go and check that out. And I look forward to staying friends with you.
It was a joy chatting with you as well. Thank you, Catherine.
Thank